Coming up next, you're going to have an opportunity to hear from Dr. Kayur Patel, who is an expert in looking at the patient safety aspects of our very complex healthcare system. He is a physician who is the chief medical officer of Proactive MD and is a noted speaker and expert in this field. Dr. Patel, what were some of the key topics that we covered in the podcast that we just recorded?
Pat, the key thing is the medical errors continues to be a big concern of everyone. Knowing that the systemic errors are much higher than the human errors is something that we need to acknowledge first. Second, create an ecosystem from the board members down, from the leadership, a culture of safety within your system, healthcare system, or the smaller systems. And third is to develop a systemic approach, simplified, that one walk through anytime there is a possible gaps in care or a delay in care or the wrong drug or medication error. So that way, if it's a systemic approach, easy to follow, then we can run through that system and analyze even the smallest gap in care or potential gap in care so we can improve the process in the future. And knowing this, the key thing is to really develop something in-house that works for your system, your colleagues, your leadership, is what I call the anatomy of a systemic gaps in care. Just a blueprint, something that works for you. And looking at the systemic errors, looking at 8 major broad buckets, we can embed these into the workflow.
And Dr. Patel points out in his podcast how you can use those 8 buckets when you're analyzing medical records or working with your attorney client to suggest some documents to be obtained during discovery or questions to ask in deposition of defendants. All of that and much more in Dr. Patel's podcast coming up next on Legal Nurse Podcast. Be sure that you catch this show. It will change some of your thinking, I believe, as we spend a lot of time in the legal system pointing at individuals as the cause of an error, when in reality they are working within a system that may not support them effectively in delivering quality care. So catch that podcast coming up next on Legal Nurse Podcast.